This is part 2 of infectious disorders. In this part, we're going to discuss mainly signs and symptoms of different types of infections and mainly typhoid fever. But before I proceed with that, uh, I would like to emphasize one point which I missed to tell you in part 1. If in the event you injure yourself or you prick yourself with a needle that was used on a patient, make sure that you inform your supervisor right away, immediately, because there are certain measures that need to be taken. The patient has to be tested for hepatitis and obviously for HIV. God forbid if the patient is positive for hepatitis or HIV, then you will be at risk uh, to catch the infection. So please, you have to be very careful not to prick yourself with a used needle, and this is the reason why we don't recommend recapping the used needles. And in the event, God forbid, it happens that you pricked yourself with a needle that was used on the patient, make sure that you inform your supervisor, your instructor, your nurse manager immediately so that the proper measures will be taken. Okay, what are the signs and symptoms of infection? For localized infections, if someone has localized infection, the subjective symptoms would be pain, tenderness, warmth, redness, swelling, and itching. Uh, by localized infections, I mean uh, infections that are localized uh, at a certain location, meaning that the infection could be on your skin, it can be visible. The infection can be obvious on the breast, for example, if a woman develops infection in the of the breast. So these are the subjective symptoms that will show. What about the objective symptoms, objective findings? There will be edema, swelling, redness, warmth of the area. If you touch the area, it will be warm. There might be some exudate or drainage that could be bloody, it could be serous, cloudy, clear, creamy, or purulent, depending on the cause of infection. If the cause of infection is a bacterium, for example, then the drainage would be purulent. Signs and symptoms of respiratory tract infections. The subjective symptoms include sore throat, rhinitis, congestion, cough, sputum, chest pain, shortness of breath. I'm sure many of us have experienced at one point these symptoms. The objective findings would be fever, depending on the cause of infection. If it's bacterial infection, then definitely the person will develop fever, and because of the high temperature, the pulse rate will increase. The white blood cell count will increase if it's bacterial infection. Positive throat culture, especially if it is a strep infection, then it will show, the microorganism will show in the throat culture. Positive x-ray findings, if the patient has, let's say, pneumonia, it will show on the x-ray. Positive sputum culture, again the microorganism will show in the sputum. And obviously abnormal breath sounds, if the patient has consolidation or pneumonia in the left lower lobe, for example, the breath sounds on the left lower lobe would be absent. The major signs and symptoms of gastrointestinal infections include subjective, nausea, vomiting, diarrhea. To your surprise, this time nausea, vomiting, diarrhea are important complaints. The patient might complain of anorexia, abdominal cramps, and distension or bloating. The objective findings would be fever, again, tachycardia, increased pulse rate, white blood cell count will be elevated if it's bacterial infection, or positive guaiac test. It means a stool test that shows that there is blood in the stools. So this could be a sign of gastrointestinal infection. It's not necessary that the patient will exhibit all these symptoms, but he or she might have some of these symptoms depending on the causative agent of the infection. Signs and symptoms of genitourinary infections include dysuria, frequency, urgency. You all know this already. These are signs of urinary tract infections. Hematuria, purulent or foul discharge. Again, the patient might have some discharge and it could be purulent. And flank or pelvic pain. I hope you will guess what would cause this a flank pain. What kind of infection would cause this type of pain? The objective findings would include fever, elevated white blood cell count, and positive urine culture. If someone has generalized infection, then the subjective symptoms would be fatigue, malaise, weakness, headache, lightheadedness, congestion, muscle pain, joint pain, decreased appetite, and the objective symptoms would be fever, increased pulse rate, hypotension, altered mental status. The patient might even go into shock, confusion. The patient might develop convulsions. Uh, the patient might develop jaundice in case of hepatitis, for example, and white blood cell count may be elevated. When I say generalized infections, it means that the patient might have bacteremia, in other words, uh, infection in the blood, bacteria within the blood, which might cause or result in septic shock, and that's why the patient will develop hypotension and shock and then confusion and convulsions because of decreased blood flow to the brain, etc., etc. Okay, uh, in this slide I will just introduce to you what is brucellosis. It is an infectious disease which is not very common nowadays, but it, it is still there. It exists in our country, and you have to be very careful not to get this infection in a very easy way. The prevention of brucellosis is extremely easy, and we will see how can we prevent getting this infection. It is a systemic bacterial disease. It's a bacterial infection. It is quite a serious disease. It is caused by bacilli of Brucella genus. Don't worry about these names. It is transmitted via the ingestion or contact with unpasteurized dairy products. When I say unpasteurized dairy products, in other words, if you drink milk which is not pasteurized, you might get brucellosis. The milk that is coming from goats, from cow, uh, and other animals. I'm sure you know what pasteurization means. Now, in the villages, uh, they are usually, I mean, they keep animals that live in the farm, and they milk these animals and they drink the milk directly once it is ready, without pasteurizing. So if at at some point somebody drinks unpasteurized milk, or somebody eats, let's say, labne, which is made of unpasteurized milk, or somebody eats cheese, which is not which is made up of unpasteurized milk, then he is at a risk to develop brucellosis. The disease is not transmitted from person to person. It's just transmitted by uh, ingestion of unpasteurized dairy products. The onset of brucellosis could be acute or insidious. The incubation period is 5 to 30 days. There are 30 days where you can carry the infection, the microorganism, but still be asymptomatic. It could remain subclinical or unrecognized for several days, or for months, or years, or even for years. This is in very rare cases. Uh, Treatment is, of course, administration of antibiotics, antibacterial drugs for at least 6 weeks. Prevention, this is what I want to emphasize: prevention and control. It can be easily prevented, as I said, by pasteurization of milk and milk products. So make sure that you don't drink unpasteurized milk. Uh, you don't eat dairy products, labne, cheese, laban, or any other dairy product, ashta, uh, that are made up of unpasteurized milk. Now, when you go to restaurants in the mountains, they bring you what we call jibne baladiye. I always am hesitant to eat this type of cheese, although they say it tastes very nice, but I haven't tasted it at all, because I cannot be sure that the milk they have used to make the cheese is pasteurized. So you have to make sure that the milk that you're consuming is has been pasteurized. Now, whatever is present in the supermarkets, the powder milk, etc., all of these are definitely pasteurized. What I'm talking about is the milk that people consume in the villages that are still very far away, and people are ignorant there. So this is all what I want to say about brucellosis. And by the way, brucellosis in Arabic is hamma al-maltiya. Oh, the symptoms that the patient might develop include headache, weakness, profuse sweating, chills, arthralgia, weight loss, and generalized aching. And the fever is usually, I haven't mentioned here fever. Uh, Please add fever to this list. The fever is usually very high, with chills, profuse sweating, and the patient feels really, really sick. Okay, what about influenza vaccine? We know that every year there is an epidemic of influenza, and fortunately, we have a vaccine for the influenza. It is an acute viral respiratory disease that predictably and periodically causes worldwide epidemics known as pandemics, like the influenza that was a few years ago, H1N1, etc. Okay, so as I said, fortunately, we have the influenza vaccine. However, it's not the same vaccine for each year that we take. Each year, a new vaccine is composed of three virus strains, two type A influenza strains and one type B influenza strain. Specialists, uh, they anticipate what are the viruses that are going to cause influenza for the coming season. Therefore, they come up with the proper vaccine. So they consider the most likely influenza viruses that will occur in the coming season, and consequently they try to develop the proper vaccine. However, the vaccine does not offer 100% protection, but it offers 70 to 90% protection for healthy children and young adults, although it is less effective in older adults, obviously. Uh, in patients who get infected with influenza, the severity of the illness decreases usually if they have been vaccinated. The vaccine is administered as an injection, and I'm sure some of you have already taken the influenza vaccine once or twice or maybe more. Uh, who are the people who should receive the vaccine? So annual influenza vaccinations for the following groups are recommended. People older than 50 years of age, definitely. Children 6 to 23 months of age. Pregnant women. Residents of extended care facilities. These include residents of nursing homes, okay, or let's say patients who have psychiatric problems and they live in a psychiatric hospital. Again, these patients should take the vaccine. And people with chronic medical diseases, even if the person is, let's say, very young, 21 years old, 22 years old, but mainly during this age, the main chronic condition that exists is, as you know, asthma. So people who have asthma should be vaccinated for in order to prevent infection from influenza. So older adults, those who are 50 years of age and above, children 6 to 23 months of age, pregnant women, residents of extended care facilities, and those with chronic medical diseases should be taking the vaccine every year. The optimal time of taking the vaccine is the month of October, because it is during this period that the influenza endemic or epidemic usually develops. So it's best to take the vaccine during the month of October. Okay, in addition to these groups of people, healthcare providers are at a higher risk to get the infection, maybe from the hospital, from the patients. So therefore, they need to be vaccinated in order to protect themselves. So healthcare, we as nurses, we are healthcare providers. Therefore, uh, I recommend that you take the influenza vaccine, and I think it is for free for AUB nursing students, because you are taking care of patients in the hospital and you are in contact with the hospital environment and with sick patients. So that's why you have to take the vaccine in order to protect yourselves. Okay, now we come to salmonella infection, which results in typhoid, what we call typhoid fever. Salmonella is a gram-negative bacillus with many species, and the organism that causes the typhoid fever is called Salmonella typhi. This organism contaminates more than 50% of commercially available chicken products and are frequently found in eggs, in raw milk, and occasionally in beef. So if, let's say, someone ingests a beef from an animal who has the infection, who has been infected with Salmonella typhi, and the meat was not very well cooked, then there is a risk that the person will get the disease. The same thing with the chicken. If the chicken was infected with Salmonella typhi and it was not very well cooked, and you ingest this piece of chicken, then you will get the infection. Raw eggs should never be ingested. Don't ever eat raw eggs, because you can never be sure that they are not infected with Salmonella typhi. The same thing with raw milk. When I say raw milk, I mean unpasteurized milk. So the person who has this type of infection is a source for transmission to others. The disease or the infection is transmitted from a person to another person. The importance of good hygiene should be emphasized, and healthcare workers, including nurses, including us, should use special care when taking care of these patients, especially when handling bedpans, stool specimens, or other objects that may be contaminated with feces, because the route of transmission of this microorganism is from the GI tract. In other words, the microorganism appears in the stools of the patient. So if I'm handling the bedpan of the patient and I don't practice good hand hygiene after I handle the bedpan, I might be getting the infection. If I'm taking a stool specimen from this patient, and again, I don't wash my hands very well after the procedure, I might get the infection. Any object that may be contaminated with feces, like the sheet, the linen that was under the patient, if it's contaminated with feces and I touch the sheets, then I need to wash my hands very, very well. So the disease is characterized by insidious onset. It's not acute onset, it's insidious onset. The symptoms include fever, headache, malaise, cough. Cough should be there, non-productive cough. So fever, headache, malaise, and anorexia. Bradycardia, relative bradycardia, this is very characteristic of typhoid fever, although the patient might have fever, but still the patient develops bradycardia, not tachycardia. He might develop splenomegaly, rose spots on the trunk, non-productive cough, constipation, or diarrhea, either one of them. Okay, if you remember in part 1, I explained to you what is a carrier, who is a carrier. So when we talk about typhoid fever, it's very common to talk about carriers. A carrier is a person who is still carrying the microorganism, but he or she is not showing any signs and symptoms. like the family contacts, the family members of a patient who has got the infection may become a carrier. uh, 2 to 5% of patients who develop the disease, who develop the infection, they become permanent carriers. They are not permanently cured from the infection. So transmission, how is the disease transmitted? As I said, transmission is through the GI tract. It can be transmitted by contaminated food and water. It could be transmitted by shellfish, raw fruits, contaminated milk and milk products. Also, flies may infect food. So when I say flies may infect food or contaminated food, it means that the fly may be, now this is not a very pleasant topic to explain, but I have to do it. If the fly, let's say, may be sitting on the excreta which is infected, and then it comes and sits on your food, on your plate, when you are in a restaurant, let's say open air in the mountains, there are so many flies there, and then you eat that food, then you're going to get the infection. The incubation period depends on the size of infected dose. It's usually 1 to 3 weeks, 10 to 14 days. As I said, the onset is insidious, so it doesn't appear acutely. It takes 10 to 14 days until the symptoms start appearing. And the person can be infectious or contagious as long as the bacteria appear in the excreta, which is the first week from the time he was exposed to the infection until convalescence. During this period of time, the person can be contagious, can transmit the disease from one person to another. It does not exist, I think, in our country, unfortunately. Drinking water should be purified. If you're not sure that the water you're drinking is purified, then you can put a drop or 2 drops of chlorine in it to make sure that the microorganism will be destroyed or killed. Proper handling of food, refrigeration. Food that needs to be refrigerated should be put in the refrigerator. For example, you cannot put milk or meat or chicken or dairy products at room temperature. They're going to be spoiled. They're going to be destroyed. And if you do, and then you don't cook it very well, then you might get the infection. Of course, pasteurization or boiling of the milk is also very important. So exclude carriers from handling food. Make sure that those who are handling food are not carriers. This type of precaution, if a disease is transmitted from the excreta or the microorganism comes out, exits through the GI tract, through the excreta of the patient, this patient should be placed on what we call enteric precaution, meaning that we have to be careful while handling the excreta of this patient. How can we make sure that the patient is not a carrier anymore and he has been cured from the infection? You have to take 3 consecutive cultures, stool cultures definitely. They should be negative, 24 hours apart. Yani for 3 consecutive days, you take a stool specimen for culture and they should be negative. If they are negative, the three cultures are negative, then we are sure that the patient has been cured. If any of the cultures is positive, repeat cultures at 1 month interval during 12 months period. Treatment of typhoid fever is definitely administration of antibiotics. Now, in the past, the antibiotic of choice was chloramphenicol. Uh, this was the main treatment for typhoid fever. Nowadays, they are trying our other types of antibiotics, such as quinolone derivatives, levofloxacin. They're trying the third generation cephalosporins like ceftriaxone, or they are even trying Bactrin, which is sulfonamide.